The New Jersey Center for Tourette Syndrome and Associated Disorders, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate any treatment. You are responsible for your own medical decisions. Now I'm going to turn over the introductions of our speaker to Martha Butterfield, the Program Coordinator of NJCTS. Marty?
Thanks, Kelly, and good evening, everyone, and thank you for joining us. I'm pleased to introduce everyone to Martin Franklin, Ph.D., who is Associate Professor of Psychiatry at the University of Pennsylvania School of Medicine and Director of Penn's Child, Adolescent, OCD, Tic, Trichotillomania, and Anxiety Group, otherwise known as Cottage. For over 20 years, Dr. Franklin has conducted clinical research projects on OCD, trichotillomania, Tourette syndrome, and related disorders. In collaboration with colleagues at Duke University Medical Center, he recently completed a pilot study of cognitive behavior therapy, or CBT, for Tourette's disorder in adolescents and young adults. He has presented on the psychopathology and treatment of OCD, trichotillomania, and related conditions across the developmental spectrum in lectures and workshops, both internationally and nationally, and continues to be active clinically in providing CBT for OCD and related conditions. He's also a member of the Science Advisory Board for the OC Foundation and the Trichotillomania Learning Center. It's with great pleasure that I now turn our program over to Dr. Franklin.
Thank you so much. I want to welcome everybody, and ironically enough, for my discussion of the nature and treatment of hoarding, I've accumulated a lot of material. So what I'm going to try to do is go relatively quickly to leave us some time at the end to discuss pending questions. Let me first, before I move into the lecture content itself, I just wanted to quickly describe some disclosures, research support that we've gotten at our center from NIMH, the Tourette Syndrome Association, benefactor monies as well, some speaker honoraria that come from various academic institutions and the International OC Foundation as well, and royalties from a book from Springer Press on the treatment of trichotillomania. But we're going to focus tonight on hoarding. And I must acknowledge some assistance from my friends and colleagues, Drs. David Tolan, Randy Frost, and Gail Steckety. These are the folks I believe are in the vanguard of hoarding research, have been helping to push the envelope in terms of better understanding the psychopathology of hoarding and using that information to help us develop better treatments. And there's a reason we need better treatments. Hoarding seems to be a negative predictor of outcome for some of the available treatments, which is why David and Randy and Gail have collaborated on trying to improve the situation with respect to treatment outcome. So I want to thank them for their help. Quickly, by definition, this is from Frost and Hartle. What is compulsive hoarding? Basically, it's the acquisition of and failure to discard large numbers of possessions. It is associated with living spaces that are so cluttered that it precludes their intended use. And I'll show you some pictures in a moment that may help bring that to life. There's also significant distress or functional impairment that's caused by the clutter. I think there's something important to talk about here too, which is that not everybody who has too much stuff or has a lot of clutter has clinical hoarding. And when you start to treat hoarding, you may well run into some specific cognitions and behaviors that are evident in people who've got this as a clinical problem as opposed to people who are too busy to clean out the garage. And we'll talk about the continuum from having too much stuff and having difficulty getting around to doing it into the more clinical situations where people are having tremendous difficulty for a host of reasons, letting go of hoarded material and also going out of their way to accumulate more material, which is something we'll see together in a minute, is a significant problem in hoarding as well. This is an example of what used to be a kitchen. I believe there's a table in there, and you see quite a variety of material. I see at least 2 pocketbooks. I see a bunch of bags. I see that there's absolutely no room on the counters for cooking. This is not an unusual situation. In some of the work that I've done, I've also gone into these kitchens and found books in the oven as a means to hide them, as a means to collect them, and as you can well imagine, the fire department would not be pleased by books in the oven. There's significant risks associated with hoarding, which we'll talk about in a moment as well. So that's a kitchen. This is the next one, a bedroom, I believe, possibly a dining room. It's hard to tell. But you see there, I believe there's some chairs. Yeah, it looks like a dining room. And you've got a pretty wide variety. You've got a lot of books in the foreground. In the background, you've got quite a bit of clothing, and it looks like some attempts to sort this have been made. I see bins. I see a lot of open bin labels up on the top. I also see some tops of bins, and I see a lot of sort of mixed material, which makes this much harder to get rid of, which we'll go through in a minute. Disorganization, as you can imagine, will play an important role in how quickly or how slowly you'll get through this kind of material. Here's another example where you see bags. You see a lot of clothing that may well be new clothing, may well be clean clothing, but sometimes it sits so long that it's no longer useful. I've been in many of these circumstances where brand new clothing is now tattered and moth-eaten and needs to be all simply discarded rather than used. You see again a lot of printed material. I see baskets full of baskets in the corner, wicker, and wicker is notoriously difficult to clean. And so sometimes when you see that, you may well have all the contents in those baskets be unusable. So we'll keep that in mind as we go through the houses of people we're trying to help. Here's another example. Looks like primarily newspaper, and it looks highly disorganized. There's some bags underneath the newspaper, and this looks like a pretty mixed allotment of material. And again, that makes it difficult to make the decision to discard because you can't quite tell what it is. So you've got newspapers from the 1990s mixed in with with taxes and current bills. It's hard to just simply grab a whole chunk and get rid of it. So those are among the problems you'll run into when you're trying to help somebody to get control over this kind of space. You've got the outside of someone's home. And you see here along the walkway a lot of material that might have that sort of flavor of I could use this someday, which is gets the hair on the back of my neck going when I hear that sort of logic, because I might need it someday means it's not time locked and it's to be kept indefinitely. I see a laundry basket that likely has been sitting out for a couple of years, so my guess is you might potentially need a laundry basket, but not that one. And yet people sometimes get stuck on the idea that it's still usable and therefore I should keep it. That results in spaces that are no longer functional. You can't bring people back here for barbecues, you can't have kids in here, you can't mow this lawn, and it looks sort of like an abandoned space, and yet it's not. And spillover, you'll see in the back of this truck, bags full of additional material we often find in folks with hoarding. It's important to ask these questions. Cars filled with material, second apartments, storage malls, all sorts of things that they're basically being used to store the stuff that just burst out of the house. And so many times people are driving around, and if you're driving this truck, you can't see anything. So it's precluding the use of the truck in a safe way. And it may well be that this is somebody's intent to drive this and consign it, and they never got around to it. It could also just be spillover that simply came out of the garage and needed to go somewhere, and rather than deal with it, the person avoided it and put it in the car and has no plan to get rid of it, and really maybe not the skill set to get rid of it too, which becomes an issue as well. Epidemiology of hoarding looks like a pretty common problem. And certainly, I suppose it always depends on how you define clinical hoarding. But if you define it somewhat broadly, you're looking at weighted prevalence of 5%. It looks like it's about 3 times as common in people aged 55 and over. That could simply be a function of having more time to collect. Could be a function of other things too, such as neurocognitive deficits, aging, and other kinds of things that can perhaps be associated with not handling things as efficiently, becoming more disorganized, having less energy to deal with things as they come in. Looks like it's twice as common in men, even though the epidemiology data would suggest that OCD is roughly equally distributed across genders with other types of subtypes of OCD. And for some odd reason, over 4 times as common among low income. That's lots of reasons that could be, which I won't focus on just for the moment because I want to get into the more clinical content. But this is a pretty common problem, and if you broaden that definition to people who have too much stuff, my guess is that there are lots of people on this call and lots of people who have relatives on this call who would meet those broader definitions. But they may not have as much difficulty getting rid of stuff, which is maybe where the rubber meets the road in terms of clinical diagnosis. Manifestations of hoarding, we're going to talk about each in turn. Resulting in clutter, you've got the acquisition element, you've got the saving, and disorganization, which plays a pretty important role and can really get in the way in terms of being able to make headway in getting the person to confront the clutter and to be effective and efficient in getting rid of it. So we'll talk about each in turn. We'll start with acquisition. Acquisition can be done in a number of ways. It can be going actively and buying. So buying online has become a big thing. I oftentimes walk into the houses of folks who hoard and see a lot of unopened boxes from Amazon. So they purchase things and they sort of put them in the corner, and I'll get to it at some point. I've walked into the house of one person whose entire small bedroom was filled with nothing but full and unopened Amazon boxes. So they just continued to purchase even though they didn't use anything. Seeking out free things, pamphlets and those sorts of things at book fairs and the like. Sometimes people resort to stealing when they don't have the means to acquire material. That's less common, but certainly is a possibility for folks with hoarding problems. And sometimes a lot of passive acquisition. So the mail comes in and doesn't get opened, and we get a lot of junk mail every day. So you accumulate that over the course of time, and if you don't deal with it, it can be a pretty big pile after a relatively short time. It could also be the case that, and I've certainly seen this, where somebody's functioning okay, they've got this vulnerability, they're hoarding, they're not dealing with things effectively, and then a parent or another relative passes away, and then their material from their home needs to be put somewhere. And a lot of times people then will, rather than sort at that time, they'll just simply sort of store it in their own home for later, and you wind up seeing living spaces precluded pretty quickly, and again, no real skill set to deal with that. So sometimes you see that sort of precipitous decline in their functioning when they get hit with large amounts of material at once. The percentage of folks from Frost sample who have significant acquisition problems, you see that buying is extremely common. Gathering of free things, 60%. And then you've got a pretty larger than 50% are buying and accumulating free things. Stealing wasn't evaluated in here, but again, that's less common pathway to accumulation. Difficulty with discarding is the second element we were talking about. So saving, and the types of items can vary tremendously from things that could well be used someday, could well be considered intrinsically valuable, to things that clearly probably can't. And also you've got these other emotional elements, attachments to the material, sentimental attachments. For example, going to a play and keeping the playbill. And keeping maybe 3 copies of the playbill for something that you saw 15 years ago. And people get sentimental about it and say, well, if I discard this, it may well mean that I didn't fully appreciate being taken to the play, and so it gets attached, and you wind up with keeping all 3 of those. And if you do that for every play you go to, next thing you know, you've got a pretty good-sized accumulation of material. So sentimental reasons are commonly cited for folks with hoarding. And oftentimes those spreads. I had a kid once, which is a little bit unusual. Kids is less common to see hoarding in kids, who had a favorite aunt who bought him a stuffed animal when he was maybe 5, and this is an 11-year-old. So he kept the stuffed animal, which I imagine most kids would keep. But he also kept the box. He kept the tissue paper. He kept the bag she gave it to him in, and anything else associated with it. And his logic was that it was such a nice gift for her to be giving him, that it would, the bag and the tissue paper might feel badly about being discarded, and maybe that meant he wasn't as appreciative as he should have been. So that sentimental attachment to paper and boxes winds up resulting in a lot of collection of things that for most people would not seem relevant. Instrumental collection, which is I might need this someday, I might find some use for this. The old laundry basket I showed you earlier. And sometimes not really paying attention to the condition that things are in, and it's possible I might need it, therefore I will need it, therefore I should keep it, not taking any risks. And there are some things that have intrinsic value, and those things are going to vary when people start talking about their quote-unquote collections. It does raise some potential issues with how much or how little you can actually discard. A lot of times, though, when you've got all sorts of different kinds of accumulations, the intrinsic collections may be damaged beyond repair, and maybe they've got, I've seen this before, where I've seen somebody with every single issue of TV Guide since TV Guide was initiated, except now they also have a backup set, and then another backup set behind that. Now, next thing I know, I've got a whole wall of a bookshelf that's filled with TV Guides, in case something happens to the other. I have 2 spares to replace the one that's the real collection. So you've got these sorts of things. Certainly you have people who are actively involved in the flea market business who will say, I could sell this someday, and this is valuable to somebody, and then they wind up a lot of times going out and buying a lot and not selling a lot. That's another sign of and a way that people can accumulate quickly. So these attachments are important to evaluate when you're trying to help and when you're trying to do formal clinical treatment. Disorganization is a major issue. Back to my picture from earlier of what seems like newspaper and books and bags, and could be pretty much anything. So the condition of the home is going to be particularly compromised if you have a lot of clutter and you have clutter of mixed importance. If you've got a row of old newspaper and everybody knows it's old newspaper, it might be much faster to take that out than it would a pile like we're looking at right now, where there could be lots of different things in it, and it's going to slow you down in terms of sorting. In terms of behavior, you've got this sometimes people going through it and churning through it, if you will, and reminiscing as they're moving a pile from one side of the room to the other. You've also got this concern in some folks with hoarding, which is if I have it out of my sight, then I can't be guaranteed that it's still there, so I better leave it out. So an avoidance of filing, which results in a room like this. And somebody bumps into the pile, and then that gets knocked over, and then you just sort of put things on top of the pile because you have a vague sense of what used to be in it. There's a pretty heavy family burden in terms of growing up in a home in which hoarding has been a significant problem. Reported from the children of I believe adult children of folks with hoarding problems, increased embarrassment, decreased inviting friends over, certainly strain in relationships with parents. The home is just not a place where the kid feels comfortable bringing people, or the parents say you're not allowed to bring people. And that can lead to strain, and it leads to other kinds of compromises that parents may not be recognizing that they're making in their relationships with their kids. And in general, these folks have reported retrospectively less happy childhoods, and perhaps for these reasons, perhaps for other reasons as well. But there certainly are some practical implications for the family of somebody who's grown up in this circumstance, especially as the parent ages and the circumstances grow worse. You get a lot of people who wind up having ultimatums given by their kids and ultimately choose their material possessions over their families and feel awful about it, but don't feel like they have the skills and the wherewithal and the strength to do anything about it. So that's oftentimes where we'll be summoned and get somebody into treatment. Sometimes the family will call, sometimes the landlord will call, and sometimes the person themselves realizes that I need to do something about this or I'm going to lose contact with my grandkids. Very sad. Another issue, practical issue, this is from Melbourne, Australia, the fire department there, really looking at 8 times greater ratio in terms of dollar loss to the owner in a fire in which hoarding has been an issue in the house as opposed to non-hoarding. And primarily, it's simply that you've got more material to ignite. And containment to the room of origin, the vast majority of times in home fires, it can be contained to the room of origin, which reduces damage. But we've got a room that's completely filled with newspaper. That does not help you contain it to one room. And in terms of presence of smoke alarms that are operating, you've got a big issue there too. Sometimes because people can't get into the room to change them. Sometimes because they simply will open the door, they see the material, they know there's a smoke alarm in there somewhere, but they get overwhelmed and they avoid and they close the door. As a result, you've got a pretty serious risk of fire and often fatal fires. We're looking at fatal fires from that same data set. Hoarding households, much greater risk for these sorts of things, accounting for 25% of all preventable fatal fires since 1999 in Melbourne. The victims in those fires were over the age of 50. 75% had inoperable smoke alarms, and in 75% of those instances, the fire spread past the room of origin, which may well be what resulted in the fatality. There's an issue of insight, which we know in OCD. There's a range of insight. You see this on the right. This is a study that was done for the DSM-4 field trial, 1995. And you see that most people with OCD have at least some insight, so excellent insight or good insight or fair insight into the senselessness of their obsessions and compulsions. So you've got some people with poor insight and some who are truly almost delusional in the sense of really believing in their heart of hearts that if I don't do my compulsions, these horrible consequences will occur. And what you see in hoarding is you see that continuum of insight has been spread across in a very different manner such that you've got less insight to work with. And lower insight is associated with poorer outcome to cognitive behavioral interventions, and that may well be mediated by poor compliance with treatment. If I'm convinced this is really important material, I'm not going to take the therapist's advice to throw it away. And as a result, you wind up with not as much done, you wind up with more compulsions remaining at the end of treatment and poorer outcomes in general. So this is a major issue and you want to be evaluating this as a therapist. When it looks in terms of challenges we have with elderly hoarders in particular, you've got some general age-related issues to deal with, reduced capacity and decreased physical and emotional support that's relevant to everybody who's elderly, or certainly most people. And then in particular that interacts with hoarding and that you've got major safety issues. You've got somebody who's not steady on their feet and they're trying to cut through a room that's got a path about shoulder width in it. The risk for falling is much higher. Emergency access is compromised. If you think about that backyard shot where you can't get into the garage, and those are things like that that put people at great risk. Obviously fire we've talked about. There are respiratory problems and self-care issues associated with physical health. Sometimes the bathroom fails to function. The toilet is no longer working. But then the person with the hoarding problem is so embarrassed by the clutter and so embarrassed to bring people in, they don't get a plumber. And you wind up with people who don't have working showers. You wind up with people who don't have working toilets in their homes, and they wind up making other arrangements which are associated with poor physical health outcomes, or just simply avoiding it altogether. Social isolation, embarrassment about clutter, resulting in not bringing people in, and you stop getting invited over, you stop inviting people over, and you wind up feeling more and more isolated. Legal problems as a result of compulsive buying, unpaid bills from overspending, losing bills in the midst of all that clutter. put your bills down and you fill them on top with pamphlets you picked up from the book fair, and next thing you know, you can't find your bills. And it feels overwhelming to tackle that pile, so you wind up not doing it, and you wind up getting behind, and less inclined to apply for services of a variety of kinds because of fear you'll have to bring people in. And certainly increased risk of homelessness due to eviction. Landlords, as you could well imagine, would not tolerate this well and don't understand it well either. So a cognitive behavioral model of compulsive hoarding, I want to provide that now, but I also want to keep in mind that we have therapists on the line here who may well be doing this as part of their professional work, but I also want to broaden our discussion here and ensure that family members who have people that they love who are suffering with this problem, that they have an idea of the kinds of vulnerabilities and information processing deficits that are present. And we'll talk some as we go about how best to get around some of those things. But we've got, in hoarding, we certainly got some core beliefs about the nature of possessions and vulnerabilities, cognitive vulnerabilities that wind up getting in the way of people making real progress on reducing clutter and stopping themselves from spending and acquiring new material. Information processing deficits we'll talk about in a moment. Problems with emotional attachments in particular, and that becomes a real issue when you have somebody whose majority of their clutter is associated with a lost loved one, for instance. They can't bear to part with the husband's jackets, even though the husband passed away 10 years ago, and the husband happened to have many, many jackets. Well, you wind up in a position where you don't have a functioning closet and you have nowhere to put the other materials that have been collected over the years. Beliefs about possessions can get in the way, behavioral avoidance, as we talked about, and also motivational problems, which need to be addressed in the context of trying to help somebody with hoarding problems. These emotional attachments are often associated with the kinds of statements that are on this slide. Discarding this possession is like losing a friend. This has been with me for so long. This has been my laundry basket since college, and as if the laundry basket has feelings about this. I can't tolerate getting rid of this. I'll get overwhelmed. Throwing this away is like throwing away part of my soul. I've heard that before, and you know you're going to struggle with somebody who's got that belief and acts on that belief and doesn't test the hypothesis. And my possessions are part of me. They make me who I am. They're part of who I am, and therefore I can't risk discarding parts of myself. Those are emotional attachments that can get in the way. When it comes to beliefs about possessions, there's often this sense of responsibility in folks who hoard. Wasting, throwing this out wastes a valuable opportunity. This could have been used. I'm responsible for the well-being of these possessions. These chairs were handed down from my grandmother, and darn it, I'm not going to be the one who parts with them, even though they're all broken. I must save this for somebody else who might need it. So my granddaughter might need this sofa when she goes away to college. Well, if the granddaughter's 2, my guess is that the granddaughter will probably want a different sofa in the 18 years it will probably take for her to move out of the dorm. Problems with memory. So worries that if I don't keep the possession, I'm going to lose the memory and have to rely on my memory. And if you think about this in the context of treating the elderly, there are some realistic concerns about memory that are exacerbated in folks with hoarding, and then they hang on to the material possessions so they don't lose the memory. And if I don't leave this in sight, I'll forget it, so I can't take the risk of filing it. Some concerns about control you'll see. If I don't keep control over my stuff, then I'm out of control in general. And also this idea that nobody has the right to touch my things. This is a really critical issue in families and among spouses. Certainly been associated with increased risk for divorce, relationships ending, kids no longer being comfortable visiting their parents in their homes, friendships lost because the possessions and the concerns about the possessions begin to, in the eyes of the other person, be more important than the relationship, and you wind up losing those experiences, feeling more lonely, and then relying more on the ways of coping that you've developed. Vicious cycle. Behavioral avoidance, certainly just the avoidance of doing things that are difficult. A lot of times it's avoidance of decision making. So if someone might pick up a piece of that pile in the room that looked like a mixed group, And they might look at the newspaper from 6 months ago and say, well, I've kept this for a reason. And I don't quite remember what the reason was. Maybe I should keep it. Maybe I shouldn't keep it. Maybe I should. Maybe I shouldn't. Next thing you know, it goes into a pile which is to decide later. And the to decide later pile is really a real problem, because that decide later problem really will wind up slowing down any efforts you make in trying to get rid of material. Just in general, avoiding of discarding for some of the reasons we discussed. Avoiding sustained effort, which is, again, oftentimes a concern in the folks who are elderly and their health has been compromised. I don't know if I can do this. It's going to be overwhelming. What if I fall, etc. When going into a room that doesn't have much space in it, I may just put it away. And just sometimes people avoiding by putting things out of sight. A lot of those bags in the car might well have been things, I can't deal with this now. Let me put it aside. And next thing you know, you've got a car full of material and you can't see out the rear view. Motivational problems are very common. Ambivalence about change. Certainly there may well be some people who have reasonable insight, who recognize that there's reasons that they would like to have their homes decluttered and feel better about their living space and more connected to other people, but then they see the flip side of why that will be so difficult and why they want to keep their materials. So they wind up sometimes going back and forth in the same way we were describing before about keeping the newspaper or not. A lot of ambivalence about changing. And hoarding being wrapped up in interpersonal conflicts. Sometimes the spouses get into it and they, there's sort of a symbolism. No one's going to mess with my garage, and you can't tell me to throw out my old beer can collection, even though they're all rusted out and broken and barely recognizable. People get into the habit of digging in their heels, and that winds up delaying, if not postponing, progress. Just the sort of sense of being chronically overwhelmed by fatigue and stress and low energy, and I work a full day, or I'm out doing other things, and I can't get to it. I don't have enough time, and they just put it off. In terms of pharmacotherapy, we do know that hoarding is a negative predictor of outcome when it comes to treatment with serotonergic medications. We've seen one study, though, in which there was comparable outcome, but it was comparably bad outcome in a paroxetine or Paxil study. But I think in general, the hoarding is popped out as a negative predictor of outcome for SRI meds, which raises some sort of interesting questions about diagnostics and whether hoarding is best thought of as OCD, or whether it's better housed under the new condition we're all talking about in DSM-5 of hoarding disorder. Maybe a cousin of OCD. Behavior therapy. Hoarding seems to be also less responsive to traditional behavior therapy with exposure and response prevention than our other forms of OCD seem to be. Roughly 50% worse outcomes in a couple of different studies for both therapist-directed and computer-assisted exposure response prevention, and it may well be that there are some modifications needing to be made that these data would suggest that's the case, and that is really what Dave Tolan and Randy Frost and Gail Steckity have taken on as their work in the last decade, is trying to figure out with respect to the nature of hoarding, how do we understand hoarding better, and how does that information inform our decisions as to how to modify treatment, because treatment clearly needs to be modified. And so the new cognitive behavior therapy that comes out of their work involves assessment, which we'll talk about, education about the nature of hoarding and also the nature of treatment, motivational interviewing to address some of these concerns, and motivational interviewing essentially is trying to solicit change language from the patient rather than simply impose it on people. And a lot of times family members are not good at this in particular. So they walk into the house and they see a room full of what looks like trash to them, and they make a pejorative comment like, this is all garbage, let's get this out of here. And essentially you've now put somebody on the defensive to defend the reason it's there, or to defend their avoidance of dealing with it. And so motivational interviewing, the techniques are borrowed from the substance abuse literature to try to solicit the change language from patient rather than imposing it from without. We also know that in hoarding, there are disorganization problems in the vast majority of people with hoarding problems, and thus teaching them a new system for organizing and maintaining that organizational system is really important. Also, some exposure to decision making, making decisions faster and sticking to them as well, not undoing things, and certainly not having that pile of "I'll deal with this later," because that's the pile that needs to be eliminated. Exposure to non-acquiring, so going out of your way to put yourself in situations. This sounds more like traditional exposure response prevention. Going to the store, going to the book fair, walking through without money, getting used to that feeling of not being able to acquire, going back another time and going with money where you could acquire and yet you choose not to. So exposure to non-acquiring, which we'll talk about in a bit, and also discarding, actively discarding and not going bit by bit, because if you look at some of those rooms, if I go piece by piece, I'll never make the kind of progress that's necessary to help people function better and feel better. And cognitive restructuring around the specific cognitions that come up in hoarding. So we'll go through some of those in a bit. There's some encouraging data from Tolan and from Steketee in the red in terms of the % response to the specialized treatment that I just described, as opposed to exposure response prevention and SSRIs in the orange bars. It looks like the modifications seem to be associated with better rates of success. These are % responders. So what % of a sample meets a clinically significant cutoff for improvement? And it looks like the modifications are helpful, and we'll talk about them in some more detail. And more importantly, we'll talk about the principles that underlie them, which are very important in terms of helping family members to think about and to do this work. When it comes to assessment, there are some things that you definitely want to know. We tend to use the Y box in all of our work with OCD as clinicians, which basically gives you a pretty good detailed lay of the land in terms of severity, and also in terms of a checklist of obsessions and compulsions. You may find somebody has pure hoarding. You may find somebody has hoarding that's also complicated by contamination fear, for instance, and you need to know that if you're going to be useful in trying to help the person come up with a good and viable treatment plan. And we know the Y box probably underestimates hoarding severity because it doesn't take avoidance into account, and a lot of times passive avoidance is characteristic of folks who hoard. And so you may also need to use a global measure if you're doing this formally and looking at patient outcomes. In terms of other measures, there are a number of other measures. I won't describe them in detail. You certainly want to get a self-reported, if you can, inventory of hoarding and other OCD symptoms if you can. Depression is a common comorbidity. You definitely want to know how much depression there is comorbid and whether that's going to be a clinical indicator of trying to do something else. There's also the Saving Inventory Revised. This is Frost, which looks at difficulty discarding excessive clutter and excessive acquisition, really critically important information. You can gather it really quickly. In photography and videography, in circumstances when you can't get to the properties themselves, and that becomes a common issue. But I do think to me, I feel like I can't evaluate somebody properly if I don't see the hoarded material with my own eyes. And it could be video, could be photograph, it could also be in person, wherever is feasible. We've got the hoarding rating scale from Frost et al., 0 to 8 scale, which is really looking at a combination of emotional distress and impairment. And what I'd say there is it also is associated with the clutter image rating. You can see a 1 to 9 scale. Basically, you're supposed to pick the picture that is closest to the particular rooms that's being evaluated. So you see item 1 is a few things on the coffee table, whereas item 9, I don't even know there's a room in there, because it's completely almost to the ceiling, cluttered with mixed clutter, which makes it much harder to work on, as I said. A functional analysis. Whenever I'm treating somebody with hoarding or trying to help somebody who's got this as a problem, I want to know what the material is. So is it old newspaper? Is it papers from graduate school 35 years ago? Where is it? I want to know the interaction between the topography and the content. It may well be that every bit of material in the garage is old newspaper, whereas the material in the kitchen is a mixed bag in terms of relevant functional material, such as bills, and with a mix of some other things in there as well. When was it collected? What was the onset? What's the relationship between the onset of hoarding and the current state of the house? You might have a basement that was abandoned long ago. You might have a basement that is the most recent livable space, so that you can work yourself backwards from that in terms of assessing and prioritizing. What's the patient's rationale? So why did they collect it? Why did they not get rid of it? What does it gain them to have it? Which sounds sometimes like a ridiculous question, but there may well be some benefit to the patient of having this material that they can describe to you pretty accurately. So that, everyone in my family knows that if you ever need anything, you can always come here and find it somehow, and it serves that function for them. What does it cost them to have all this material? Really looking at that, unpaid bills, abandoned friendships, inability to move around, storage mall costs. You want to evaluate that, because that's going to help you certainly to help the patient make some decisions about what needs to be done. I also want to know how functional they are outside the home. How connected are they now to other people that they fear of losing, because that can be a way to motivate folks. Were they ever more functional than they are now? What led them to come in? Was it an ultimatum, or were they self-referred, and if so, why? What do they have to gain by improving? And back to those relationships sometimes. It may well be that the prospect of improving their social functioning and family functioning is a means to get them motivated to come and do the work. Any family and social support remaining? And if so, do the people who are in the person's life know anything about the hoarding, for instance? I have many people who say, my friends know nothing about my hoarding. I just don't invite people over. I tell them I don't have a very big apartment. They know nothing. So they can't provide any support around this issue. And previous treatment history, especially treatment failures. They've tried this before and it didn't work. You're going to have to deal with that history when you come up with a new plan. The motivational interviewing piece, which we talked about, is more of a style of therapeutic interaction aimed at increasing readiness for change, recognition of the problem, and acceptance of the treatment plan, trying to solicit the change language from the patient. You're trying to improve homework compliance and maintain attendance in treatment. And it may well be that by reducing the amount of painting them into the corner that you can do as a therapist and as a family member, that may actually be helpful in soliciting motivational statements from them and then having them act on those statements. Really avoiding arguments, emphasizing personal choice and control. Client who's now worried, are you telling me I'm going to have to throw away all my stuff? Therapist or even a family member just basically saying, this is up to you, it's your house, your stuff, your life, and we're going to let you make these decisions. We're going to try to help you make decisions we think are better for your health, but in the end, your choice, as opposed to ultimatums, which are going to be resulting in compromised relationships, if not broken relationships, and lost opportunities to work. Affirmations of effort, even if it's difficult for the person. You seem to be trying really hard to get here on time. It seems to bother you when you're late. Appreciation of strengths. You recognize that what this is costing you, and even when the patient is telling you basically they don't want to do it, you can sometimes compliment them on being clear, and rather than fighting with them. You don't want to wind up in these arguments because nobody wins. Making sure you don't do that as part of motivational interviewing. When it comes to organization training, we want to make sure that we're reducing categories. We have categories and clear locations for saved items, rather than I'll sort this again later. You want to have an idea of where you're going to put things. And it may well be you're better off with a category like bills as opposed to 15 folders for each separate bill. That's going to slow you down. Categories for unwanted items, we often will break this down into stuff that's going to be trashed, stuff that's going to be recycled, stuff that's going to be sold or donated, and also stuff that's going to be kept. And I'm really mindful when I'm treating and trying to help people with this problem that my ratio of trash to everything else needs to be very, very high. I helped somebody recently, actually a family member, with this. and my ratio was about 30 to 1. So 30 bags of trash to 1 recycle or consignment bag, and believe about 2 or 3 bins of material to be kept. This is one room, and it took us about, I'd say, 5 hours of pretty heavy work, but with imposing that structure up front and teaching the step-by-step process was really valuable in moving quickly with someone who's elderly and maybe wasn't as severe clinically as some of the folks we run into in the clinic, but certainly had some issues with avoiding this and finding it overwhelming and maybe wanting to keep things that were truly no longer valuable because they'd been compromised by being in the room for 30 years. So once you make that decision, keep it or remove it. Once you decide that it's wanted, it needs a category, it needs to be sorted quickly, and those categories need to be moved to an interim location and ultimately to a final location. When I can, I like to skip that middle step of the interim locations because the interim locations can just be new piles. I want to know what that final location is, and I want to time lock the movement to the new location. Sometimes you can't pick the final location because the final location is in another room that you haven't worked in yet. But you do need to be mindful of that. Once you decide it's not wanted, you're differentiating trash from recycle, from donate and sell, and then move them to their final locations right away. Trash containers, contractor bags, of real value in those. You can probably get 2 or 3 times the amount of material into those. You have to have somebody who can lift them, so that's something to keep in mind. They can get pretty heavy. But trash containers, recycle bins right there, box for charity, box for family friends, box for sale items, and time lock everything. So if you say I'm going to keep it and give it away someday, I want to know what day. And if that day comes and it's not out yet, I want to come back and say perhaps this is something we're not going to get to. So we're going to time lock it again one more time, and if it's here when we come back again to work, maybe we ought to discard it because it seems like it's too hard to do. And I think being that specific about it is really valuable. And that's true for family, that's true for therapists. When it comes to decision-making training, certainly the therapist wants to be challenging by asking some questions and also getting the client to rehearse asking themselves the same kinds of questions about whether do I really need this or not. When it comes to those challenging questions, here are just a couple of examples. How many of these do I have, and is that enough? Do I have enough time and space? Have I used this at all in the last year? That's a pretty good rule of thumb. If I haven't touched it in the last year, it probably needs to go into one of those piles of trash or recycle or sell or consign. Do I have a specific plan to use with this within a reasonable time frame? If I don't, maybe it needs to go. Does it feel relevant because I'm looking at it and I won't think about it this year? What kind of condition is it? Maybe at one time it was really a lovely piece, and now it's chipped and it's broken and it's out of style. Maybe it needs to go. And if I came upon this again in the future, would I purchase something like this if I didn't already have it? Do I really need this? And how will not having this help me solve my hoarding problem is another issue I want people to be mindful of as they make these decisions. When it comes to acquisition, identifying those patterns, is a person a passive acquirer, or do they go actively out of their way to do it? Cognitive restructuring of beliefs about acquiring. What are the thoughts that underlie it? Non-acquisition exposures, like I said, going to the flea market without money, going to the flea market with money and buying nothing, going to the flea market and buying one item, and making sure that when you bring that one item into your home, if you've got a hoarding problem, for every item you bring in, you ought to be taking out 2. Sometimes that ratio is even 3. And once I've gotten the place under control, it's 1-to-1 forever. Every time I bring something in, something else has got to go out. Alternative sources of enjoyment and coping, finding other ways to enjoy oneself and have social contact without having to resort to flea markets and saving and hoarding. Very important to do that too. There's some challenging questions that we often will use for these kinds of circumstances. Just put them up there. And in terms of exposure for non-acquisition, we often do these things called drive-by non-shopping. So going to the favored mall and sort of driving around the parking lot, and that might be the easiest one. Then we do walkthroughs, then we do browsing and picking non-shopping, and then we also will go in for items that you need and have people buy them, and then also work their way up to learning how to shop better and not buying not going to the wholesale food place and buying 25 of something when you really only need 4. Treatment for discarding, selected areas and types of possessions. I often will go try to get the most relevant areas as fast as I can. Oftentimes that's the kitchen. If I can get the kitchen back, they've got a place to sit, they've got a place to eat, they can function better. It looks nice when they're down there, and that can help with motivation, as opposed to doing the garage, which is never really in their face, and improvements in the garage are not as obvious and maybe not as likely to help move the person forward. In terms of cognitive restructuring, identifying and correcting those distortions that may underlie some of the behaviors you see in hoarding, this idea of I need it versus I want it. Valuing time, downward arrow technique, which I'll show you in a moment, and behavioral experiments. So I have this idea that I'm going to die if I get rid of this. That's a testable hypothesis. What do you say we try it out? And my guess is that in most cases, people do not, in fact, die from throwing things out. They get less anxious over time, and they learn, and they feel good about it, and they maybe it gets a little bit easier as they keep going, much the way it would in more formal exposure we use for other forms of anxiety. Just a couple of examples of cognitive distortions that you may well run into, and we get people to start categorizing them and recognize them when they arrive, and be ready to treat them as hypotheses and rather than treat them as truth. This is a specific example of an ABC sheet, so there's an antecedent. So looking at papers on the kitchen counter, the belief, so the core belief, if I throw them out, I'll lose some important information that will be devastating to me. That's a testable hypothesis, nicely put. The anxiety of looking at it is a 9, and then I would probably want to associate that with a behavioral experiment of throwing some of it out and see if that's right. Does that 9 persist forever? My guess is it won't. And challenging distortions, just a few examples of how we do that. And I think I'm going to move forward and perhaps leave us some time for questions. Just a few other examples of cognitive restructuring and how we might do that, but also how you might encourage a relative to start thinking a little bit differently if you see there's some potential interest in doing things differently, and really soft selling it, but encouraging people to confront these situations and providing as much support as you can as you do. And a downward arrow technique, which is, I believe, towards the end of my set. What would happen if I get rid of this? If that happened, why would it be so upsetting? Just on and on, really getting down to the core cognition that may well be at the heart of what's leading the patient to not deal with it, to avoid it, or actually to go ahead and acquire something that's really not necessary to acquire. These behavioral experiments, testing their beliefs, so they have all these cognitions they believe will happen. Let's just find out and carefully observe actual results. You said that if you looked at this and you threw any of it out, that you'd never recover. So let's throw out something and see if you actually do recover and your anxiety comes down. And anytime you can highlight the discrepancy between those predictions and the results, it's valuable in terms of changing cognition and probably helping you to change behavior as well, which is critically important. Just a quick summary, we've got recent material and information about hoarding that's helped us to develop some modifications to the standard exposure paradigms that have been helpful. And then ongoing education, model building, motivational interviewing being a critical aspect of helping with hoarding. More formal hands-on training for organization and decision making. Gradual exposure, as you might otherwise do, to non-acquiring and discarding, depending on how severe it is in each person. And constant use, consistent use of cognitive restructuring to challenge maladaptive beliefs that often lie at the core of hoarding. And I just want to put the last slide up here, which is a material that summarizes from David and Randy and Gail their approach, and the interesting title, Buried in Treasures, Help for Compulsive Acquiring, Saving, and Hoarding. I think this is good material not only for therapists learning how to do this treatment, but also for patients and family members to understand better what it is that they're up against and the fact that there may well be some hope in combating this effectively. And I believe that's all I have to say.
Well, you've said a lot. Thank you. And I know we're running a little long here, so I'm going to try and get to a few questions, okay?
Sure. Yep, I'm ready.
Has there been any research done that demonstrates a genetic link among families and hoarding?
Yeah, there has been, and it's also very complicated work, because on the one hand you may well have links, and certainly those have been identified in the work that's been done in OCD. At the same time, it's often difficult, and really with all OCD, especially with hoarding, where it's so obvious, and there may be so many rules of how we deal with stuff in our family, to differentiate the biological contribution from the psychosocial one. So this is the way that we learn to deal with stuff. My dad tells us never to waste things, so we don't. I think it's a complex question, but certainly if you look in the family trees of folks with hoarding, you're going to generally find quite a few other people with hoarding as well. Increased risk of having hoarding in the families of people who have hoarding themselves.
Okay. Any suggestions for legal services attorneys trying to counsel clients with hoarding problems who face potential eviction?
Yeah, I think what I would probably want to do in that circumstance is I want to, and maybe OC Foundation, maybe some other organizations, to identify somebody locally who's knowledgeable about the treatment of hoarding. Because as I said, your initial look at that from a legal standpoint is this: you have to go out and get rid of all of this today, or by the end of the week, or you're going to be evicted. What I said earlier is motivational interviewing techniques would suggest that would not be the most effective way to do this. So you might, in a circumstance that dire, want to be able to consult with, at the very least, experts who've worked with hoarding before, and identify those organizations that would be able to help you find those experts. But hopefully you're also in the circumstance where you can maybe not catch it quite at that end stage, and maybe help people to avoid that as an outcome altogether.
Okay. In your comments, there was a slide, I think, that talked about hoarding is, typically in adults over 50.
Yeah.
But we've had several questions about child hoarding. So, so tell me, or talk a little bit about what the distinctions are there. I mean, there was one question about if someone wants to keep extra water bottles by the bed, is that considered hoarding? Or having respect, a parent showing respect for a child hoarder's things.
Right.
So talk a little bit about the age.
Sure. I think that it's rare to see hoarding in kids, in part because they haven't had enough time or money to accumulate that much stuff, although some kids manage to do it anyway. But you've also got, I think, in kids, sometimes when I see hoarding in kids, it tends to be a little bit more magical. So that thing touched me, or that thing touched my lips, and therefore it contains part of my essence, and therefore I need to keep it or I'll lose my essence. A little bit more sort of the kind of games that kids might play, but without anxiety. And so you wind up having kids who have accumulated bits of string or old gum. I've had some very unusual content where the intrinsic value may not be obvious at all. It may just be sort of, if I get rid of this, something bad will happen, and those sorts of things that you would confront via the usual methods that we use for exposure response prevention, and we certainly would want to be respectful. If I've got a kid who's got a collection, I think I also need to be helpful to that kid in having them organize their collections, and I also want to be mindful that if I've got a kid who's got a tendency towards keeping too much, I want to teach them both by modeling, so me being really clear about the fact, well, I just bought a new sweater, so I got to get a couple out of here because I won't have any more space. Getting the kid involved in that sort of thing, having it be a family value in which you consign and give things away. Even if it's not their stuff, you may well be modeling it with your stuff, and it may be easier to get them to buy in without it having to be their stuff to begin with. So those are the kind of things I'd be looking at. I do think that hoarding, and when it's bits of gum and things like that, I don't want parents to go in and clear things out without the kid being knowledgeable about it, because the kids in the circumstance where they're not going to learn how to do that themselves unless they get the opportunity. And yes, it's going to be difficult. They're not going to want to do it. You can incentivize that. by giving them, if we can clear this room today or this box today, we can go do some special thing together, as opposed to getting them some other thing to replace it. Getting them into the idea that that not all rewards have to be tangible. They have to be things. They can be time. They can be enjoyable activities. They can be watching a movie. So you sort of get into the habit of not reinforcing their style of viewing things as more important.
So it's getting away from the pleasure of having the thing and finding pleasure somewhere else.
Yeah, and modeling that for yourself.
Yeah.
I haven't worn this thing in a year. What do you say we give it to somebody who really needs it?
Yeah. I had a very interesting question that I really would like to touch on, because I think it's pretty relevant. It has to do with, this individual who said they hoard computer files, emails, digital camera, all of that. And because of the technology that we have, there is this availability of just infinite storage space.
Yep.
So could you talk a little bit about that?
Yeah, I think that's a very common sort of a modern version of this that we see. The functional impairment may not be as obvious until you start looking at the organizational categories and you start looking at how much time is wasted on sorting through old emails and things like that. If I've got somebody I know has that vulnerability, my inclination is to want to be regular about purging their inbox. I want to be organizing things into subfolders, and then after a year, same thing I would with a closet. I haven't looked at anything in this subfolder for a year. Hit delete on the subfolder. So you're always keeping the space open, and you're mindful. They have that little thing on the computer showing you what % of your space is getting close to taken up. With many people, I've said I don't want you to be at any time higher than 50% of your computer is used up. And so when you start to creep out towards that, especially if it's your sent box, getting people to be organized. People will tell you, I'm going to keep all my sent mail because I don't have time to make an address book. Well, make an address book. It'll save you. And then if you send something, to somebody, and you send something 30 times a week, you don't save any of your sent box. Things like that can sort of be analogous to what you would do in a home. And I do think that's an issue, because I think it affects work efficiency in terms of time wasted on sorting through the unnecessary, if you will, and getting bogged down in the details.
The technology almost becomes enabling.
Yeah, it can be. On the other hand, if I had a choice between a entire garage full of old New York Times versus a subfolder, I'll take the subfolder every time.
I think that's smart. Would you comment on adult children who just want to fix the problem by cleaning up the stuff that's around mom's house? Do people with hoarding, do they really notice when stuff is disturbed or it disappears, or would that put someone into a tailspin to have the family come in and just go?
I think it depends entirely on the person. And having done this recently myself, I'd say we want to evaluate whether this is something in the past that's been an issue. And if you have your elderly relative following you through the house, it's clear they've got concerns that you're messing with their stuff. And so I would probably raise that in a non-defensive and non-judgmental way. And sort of make a plan. And we're going to go room by room. We're going to go item by item if we have to, but really room by room to try to help make this a safer place and a more enjoyable place for you to be. So really making it very, leaving out all the pejorative comments about why do you need this crap, this was relevant 30 years ago, because that gets you nowhere. But really trying to say that we love you and care about you and want you to have as good an experience as you can. And you're getting older, you're using a cane. We certainly don't want things around here for you to trip over. So what do you say you give us the opportunity to help you out? And so I think sort of using that motivational interviewing language that's informing the development of the treatment protocol we talked about. But I think anytime you can, as John March has often reminds me in our work together, is kindness is always better than yelling. And you're much more likely to make some productive headway if you leave the pejorative comments at the door. Especially because it's sometimes nauseating, sometimes disturbing, distressing to walk into a home that's filled with looks obviously like trash and have somebody say, "Oh, you want to go through my collections and see? Look what I found." It's like, no, not really, but you may well need to find a way to say that's more likely to get the person to understand your position, and that this is not me judging you, it's me trying to help you, and really coming at it from that perspective. I think you're likely to get further than you would otherwise.
A positive approach versus the negative, I guess.
As much as possible,
Yeah.
and not always easy. You got to forgive yourself when you have the occasional meltdown, but I think that's always where you wind up coming back to.
All right. I think that we're going to wrap it here. I know you had an appointment to get to, and I don't want to hold you any longer. So the questions that got asked but didn't get covered will be handled on the chat board.
That sounds
Thank
good.
you, Dr. Franklin. That was great. That was informative. A lot of great information.
All right. Well, thank you.
Thank you for joining our webinar on the nature and treatment of hoarding. There is an exit survey which we need everyone attending to fill out. The discussion board is now open and available for the next 7 days on the NJCTS website for any additional questions that were not covered in tonight's presentation. That website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to the site. Our next presentation, Emotion Regulation, Strategies for Children and Adolescents Experiencing Irritability and Difficulties Managing Their Emotions, will be presented by Dr. Julie Ryan and is scheduled for January 25th, 2012. This ends tonight's webinar. Thank you, Dr. Franklin, for your presentation, and thank you, everyone, for attending. Good night.